Welcome to Anne Arundel Community College. My name is Nancy Schrum, Director of Constituent Services for County Executive Steve Shue. Thank you for attending tonight's town hall, Not My Child. In January, the county executive declared a countywide public health emergency in response to use of heroin in our county. When you heard about the county executive's formation of a heroin action task force, you called our office and you asked, "How can I help? I want to help." I want to personally thank those of you that contacted our office and accepted our invitation to get involved. Thank you for your openness, sharing your child's journey, and the impact of drug use on your family. These personal, real-life events clearly provided what we need to focus on: education, access to treatment, and enforcement. Tonight, we are going to experience a candid, truthful discussion with a sincere attempt to provide awareness and education to prevent families from experiencing life-changing, tragic outcomes from substance abuse. Please help me welcome our moderator for this evening's program, Not My Child, County Executive Stephen R. Shue.
Good evening, everyone. I want to thank everyone in the audience that has joined us this evening, as well as those at home who've joined us online and on Twitter. This is the beginning of a very important discussion in our community about heroin and narcotics. Heroin is the biggest public safety and public health challenge that we face in our community today. We are currently experiencing an overdose a day, over 300 per year, from these narcotics, and a fatality a week, over 40 fatalities last year from heroin and other opiate overdose. And it's growing. Every 3 or 4 years, this curse is doubling. And heroin knows no bounds. It goes after everyone: man, woman, young, old, black, white. It is everywhere. North, south, east, west, rich neighborhoods, poor neighborhoods, and it challenges absolutely everything. It challenges our educational system, our law enforcement professionals, and our healthcare system. It is the octopus from hell. Some say it's a tidal wave that cannot be stopped. I say it's not, because I know that by working together, all of us, to put the dealers behind bars, to get users into treatment, and most importantly, to educate our young people to stay away from drugs, we will win this battle. I'd like to read to you a poem that was written by Mariah Albee to her parents while she was in rehab. When I was a little girl, my dreams were so bright, I never imagined my life wouldn't be all right. Like any little girl, I played and went to school, taught to always live by the rules. My mind was filled with dreams and hopes, unaware of the nightmare of dope. Somehow, somewhere, my dreams went up in smoke. With real life, I could no longer cope. With drugs and danger, I began to flirt. After all, who could I hurt? Whenever there was pain or anger to feel, it was stopped and stifled with little pills. Oh, but I made some progress, didn't I? I found stronger drugs to get me high. My dreams turned to hallucination. My world was empty of imagination. If my visions were to become real, there was always another pill. Slowly, all my hopes and dreams were destroyed by addict schemes. My morals and values were tossed aside as I deserted my hopes and dreams. My childhood lullabies were replaced by bent spoons. I woke to the nightmare of looking through bars. I knew I could no longer reach for the stars. I finally had to face a scary reality. No one could change this situation but me. I've learned it's okay to think and feel, to go through life without the needle. Now I can reach for the stars, one day at a time. Her postscript was, maybe you can understand me a little better now. I love you, Mom, Dad, and Grandpa. Signed, Mariah. I'd like to ask everyone here to help me welcome our panel and thank them for participating in this event. Tim Altameri is the Chief of Police for Anne Arundel County. Catherine Bonin-Contri Ravendro serves as President of the Pasco Community Services Intercept, Inc., an organization that provides innovative, integrated systems of care. Helen Rhines, a registered nurse by training and the Executive Director of Pathways. Andrea Wildison is a lifelong resident of Anne Arundel County and a mother of 3 boys. As a teen, one of her sons developed addiction to opioid medication and eventually heroin. Andrea is now dedicated to addiction prevention through community education and outreach. Dr. Christopher Welsh is the Medical Director for UMMC Substance Abuse Consultation Services, which is responsible for substance abuse and intervention with patients throughout the University of Maryland's Medical Center, and is the Medical Director for UMMC's Comprehensive Recovery Program. And finally, Russell Reel, who is an inmate at the Jennifer Road Correctional Facility, who will open up our program by telling us his story of addiction. Russell.
Wow, it's a wonderful turnout. How's everybody doing this evening? I'd like to start off by saying no matter what reason you have for being here, whether addiction has affected you personally, you have a family member afflicted with addiction, or you just want to learn more about what goes on in my experience, not only in Anne Arundel County or Pasadena where I was born and raised, but neighborhoods up and down the East Coast. And by simply showing an interest in learning, and showing an interest in educating yourself on the signs of addictions, by listening to my not uncommon story, you yourself may be able to recognize the signs of a young person heading down the wrong path, and possibly save them from addiction and a life of pain that all too often ends in jails, institutions, or death. I'd like to start off by saying there's no outstanding reason for me to be an addict. I was born into a loving family. I lived off of Sally Road on App Street, waterfront property. My dad has a great 9-to-5 job. My mom chose to be a stay-at-home mother. I have a brother that is 4 years younger than me and a sister that is 9. Wonderful upbringing. We had as much of a farm as a quarter-acre property could allow. We had ducks, geese, pheasants, even potbelly pigs. Crabbing every day, fishing, going tubing. For all intents and purposes, white picket fence upbringing. When I was 9 years old, my mom was in a car accident, and she was getting off 695 by the Beltway Motel. And to avoid a collision, she ran into a stop sign. Somehow, the sheared end of the stop sign came through the windshield and hit her in the neck and cut a nerve that controls pain, and she developed RSD, rheumatic nerve disorder. Due to that, she was prescribed very heavy narcotics. At first, she wouldn't take the narcotics because she read about them on the internet and was scared, so they were stockpiled. My parents were not negligent with pills. They were kept in a bedroom, in a dresser drawer, out of reach of all 3 of the children. It started off 9, 10 years old, hanging out with friends, smoking cigarettes. 10 years old, I stole my first beer from a cooler from a party down the street. 11 years old, I was hanging out with a friend, and his older brother was smoking weed, and I thought, hey, looks like he's having fun, why not try that? And pretty much all the way up until 13 years old, it was just beer and weed. But then a female moved in the neighborhood, and she was very badly sexually assaulted here before, unbeknownst to me. And with 9 kids in the neighborhood, when a female moves in, you notice. So I was outgoing, always tried to get her to come out and play, and eventually we started dating. Introduced her to my family. She found out about the prescription narcotics. That same year, my mom was diagnosed with brain cancer. So it was more narcotics on top of what was prescribed for the nerve pain. And she had me start stealing pills, pretty much, to give to her. And I wasn't aware of what it caused. I just know she took them and it made her happy and have a lot of fun, so I wanted to try it. So that's how my narcotic use started. At 13 years old, I would steal pills, 14 years old, to give to her and start taking to her. And it was Oxycontin back then. It wasn't Percocets or anything like that. Heavy narcotics. From 13 to 16, that's pretty much what it was. And she would coach me. If my parents ever caught me being high, it was, oh, I drank a beer for the first time, or I tried weed, and they would sit down and explain to me, well, this isn't good and this is why. My parents, I didn't see them high, I didn't see them drunk. I was blessed, to be honest with you, in my upbringing. I had no reason to become an addict. And by 16 years old, my mom was doing really bad, so she was taking all our narcotics. So I couldn't take 2 or 3 pills without them noticing. So I started buying heroin because it was cheap. And pills back then, you spend $60 for an Oxycontin. 15, 16 years old, you can't afford that. You can spend $10 going 2 miles in any direction in Pasadena, and you can find heroin, unfortunately. From 17 until 20, I was running around, just running the streets, running amok, partying, thinking I was having fun, really just destroying myself, my physical self, mental self, and my family, causing my family more pain than anybody. Moved into my grandparents' house at 20 years old because I believe it was Hurricane Irene in 2010. A tree fell in the back half of our house. My grandfather's a Marine Corps drill instructor, and my grandmother they're the perfect 50s couple pretty much. He caught me with Suboxone, and he didn't know what Suboxone was, he just knew I was doing drugs. So he wanted me to enter into rehab. Started going to the rehabs. I didn't want to get clean, so any rehab I went to, I manipulated the system. It wasn't good. And growing up through high school, I was skipping and getting high. Teachers didn't know. They thought I was just a problem child that wanted to get attention. I would go and hang out around the high school and smoke weed and go into high school and put my head on the desk and sleep, and they would just think I was trying to just ignore class or had ADHD. And nobody really ever explained to me the cause and effect of opioid addiction and the pain that it really does cause. And for the last 10 years, I've pretty much flushed my life down the drain for opiates. When you have opiates in your system, everything's okay. You can be in a gutter with no money, freezing, and as long as you have that in your system, everything's blissful, you're euphoric, everything's okay no matter what's going on around you, everything's okay with you. And I would just like to say there is other options. You can enter into recovery. It doesn't have to be jail as an institution. That once you hit your emotional bottom and you've suffered enough pain and you see what that substance has caused you, you begin to hate that substance. You want to stay clean as much as you want to breathe. And once you want that, once you want to be clean as much as you want to breathe, that's when you start to rebuild. That's when... What's that for me? Once you suffer enough pain is when you start recovering. And there's Suboxone and methadone and many ways to get clean. And yes, they're abused and used in the wrong way, but they can also be used in the correct way and help you get clean. Me personally, I went through 3 rehabs for my family, and everyone got high right after or even got high while I was in there. There's people from the Hope House that I was in that I've seen here and recognized that during the Hope House I was getting high while I was in there and got kicked out before getting high because I didn't want to get clean. Now, after being incarcerated, I've been home for 3 months since July of 2013, and I only had a 1-year sentence. Coming back on violations, I was in drug court, missed a court date, and now I'm going back to Gardenzia, 4-month inpatient rehab. Drugs have caused me enough pain, and anybody can get clean. My recommendation, if you're still using and you want to get clean, just go to a meeting. It sounds crazy, but if you just go to an NA meeting, go to the same one every week, people will recognize you, people will want to help you. they just want to see you do good for yourself, especially in NA or AA, whatever one you would choose, CDA, it doesn't matter. But being around like-minded people that have gone through what you've gone through and have experienced being the very bottom and rebuilding from nothing can tell you what you need to do. If you just go and take the advice, your life can be saved. Thank you for letting me share.
Thank you, Russell. We admire your determination and your courage to stand here and share your story with everyone tonight. We're pulling for you. We're all pulling for you. At this point, we're going to go to questions to our panel, and we'll spend about 20 minutes or so with the panel, and then we're going to open it up to questions from our audience. I'd like to address the first question to Andrea. From your experience with your son, please tell us, what are the signs that a child or a loved one might be using alcohol or drugs?
My son, I don't know how many of you were in here when the movie was playing, but he could have been any one of those kids. He could have been you. We have perfect little suburban life, great family, real close. Our first clue actually was the isolation. All of a sudden his friends started to change. The things he was involved in school were no longer interesting to him. He had the same set of kids in elementary school as his friends, and we knew them all. And all of a sudden there were different kids. And who were these kids? And then one evening my husband and I were in our living room, and he came home and he was clearly under the influence of something. And I started putting two and two together. The isolation, the change of friends, the grades dropping. Now he's high. So the next day when he was at school, I did what a lot of parents don't do and should do. I've heard a lot of moms say, oh, you know, I can't disrespect their privacy. He's 17 years old. No, this is my house. I pay the mortgage. You can have privacy when you move out and get your own place. I went through his bedroom, and I was prepared to find liquor and marijuana, which would not have been okay with me, but that's what I was prepared for. And I found bags of opiates, which were given to him by a family member. My son had a back injury on the wrestling team. We had him in all kinds of homeopathic treatment so that we did not start him on opiates, because addiction runs in my family, and I knew that risk. But another family member thought that was unfair of me to make my child suffer, and so I found the opiates, and that eventually led to heroin use for my son. So to all of you sitting here, if you have kids, if you have anyone in your life who is suddenly isolating, changing behaviors that normally make them happy, and they no longer are participating in life like they used to, signs of depression. Another thing that he did was he slept all the time, nodding off on the couch, nodding off in the car, all the time. And sometimes you would think, well, that's a teenage boy. No, it was, you put two and two together and you realize something's going on. Don't give your kids the privacy that they think they deserve. I think had I been blind or not wanting to address the issues that were going on in my home, my son would be dead today. Thank God he's a recovering addict now, doing very well, 2 years clean and sober. money, it scared him. A lot of addicts, it doesn't scare them bad enough. So keep an eye on your kids, folks, and your loved ones. It happens to adults too. That's really important. These prescription drugs are trouble.
Thank you, Andrea. Next question is for Catherine. We understand that there are many gateway drugs that lead to heroin. It usually starts with beer. From your experience, what are the triggers that motivate children to drink alcohol and later use drugs?
Thanks for the question. I actually want to piggyback a little bit on what was just said, because I think that there's a ton of that truth that was just shared about how those both of the stories got into the problem of addiction. But I do want to touch on something that you said just a moment ago. If you're noticing signs of depression, I have been a clinician for 15 years, and I can tell you that one of the things that in working with students and youth and young people, one of the things that we don't often recognize, and I think it's very helpful if we can recognize, is that a lot of the time, the reason that they're reaching out for a substance of some kind to alter their mind, so to speak, or they want to use something that makes them feel different than they feel right now, is because they don't feel good. It's because they feel actually pretty terrible and or depressed or worse. Or they're hearing voices they've never told you about, they've never told anyone about, and they're trying to make that stop in some way. And they're either drinking or using a pill to try to make it stop. So a lot of the time, when someone is sitting in front of me for the very first time, and I see their hurting face, I will literally come right out and ask them, what is it that's troubling you, and how can you help? Because I think that a lot of the time we focus on looking at what we need to do as step 2 and 3 and 4 and 5, and those are all very, very important, but I would implore you, if you're sitting here and you can hear me, please reach out to those around you and ask them, how are you doing? Are you okay? Can I help you with something? Because the hurting and the sadness and those clinical signs that are underlying, we know that statistically across the nation, nearly 75% of the time, and that's a lot, there is a co-occurring issue with an underlying mental illness. It's a catchphrase. You don't have to call it mental illness. You can call it anything you want. A hurting, a suffering of some kind. And it's in tandem with substance abuse.
Thank you, Catherine. Dr. Welsh, can you please describe for us the physical changes in the brain that starts with gateway drugs that eventually lead to heroin use?
So this is a tough question. We've used this term gateway drugs for decades, and the science that that's actually a real thing isn't really that strong with humans. There are some mouse studies, and maybe they apply to some of your kids, but most of the research don't really support that there are actually brain changes that marijuana, nicotine, alcohol, people now talk caffeine. You know, the amounts of caffeine that children are exposed to now are huge compared to, you know, a generation ago. A lot of people being prescribed stimulants. Some people think that might. So the idea that any substance is necessarily changing someone's brain to make them more likely to use another substance, we don't really see that necessarily with the studies. What we do see is that people tend to drink, smoke marijuana, or smoke cigarettes before they use other drugs. Many people who use marijuana don't go and use other drugs. Many that drink don't use other drugs. So again, it just happens that a lot of people use other substances before they use the other drugs. What's more important, I think, is what we're hearing is just genetics, so that we think 50 to 60% of addiction is genetic. So the whole gateway thing is probably less important than just being aware of if there is addiction in your family, it's something you need to be more aware of and watch out more for others in your family. The other thing that's important with the new, same new, it's been opiates go in waves. We've had waves of prescription opiates and heroin for decades. Heroin even in Maryland in our suburbs. So, and a growing number of people, when they do a big national survey every year in the country of the first illicit drug people use, a growing number, the first thing they use is a prescription opiate, so before even marijuana. So, so again, I think that's part of what we have to really not focus on the gateway. It's more just any substance, and especially when the first thing is an opiate, because they're much more, as you're hearing, they're much more easy to overdose on than any other kind of drug. So again, I think it's being aware of the family history, because that's very important. And then just being, watching out for any substance use. And, as we're hearing about, just kind of watching changes in behavior and what the child is doing.
Thank you, Doctor. Helen, as I mentioned a little while ago, is the Executive Director of Pathways, which is an affiliate of Anne Arundel Medical Center, and it's one of the providers of rehabilitation services here in Anne Arundel County. Helen, what is, as a parent, what is my first step to accessing professional medical assistance and treatment for a loved one? Or in other words, who do I call when I need help?
Good evening. This is not an easy question to answer. Finding treatment can sometimes be very difficult. I would recommend that it's really multifaceted, dependent upon your resources. If someone has commercial insurance, the first thing I would say would be to call the insurance company, because they contract with different treatment facilities and substance abuse and mental health providers, and they can let you know who is in your network. If someone has medical assistance, that would be the same thing to do, would be to call the insurance company. Someone that is not covered by any insurance plan, the county health department has resources. I can give those to you. There are also several different websites. The internet can be a big help. I can provide those to you. One is the Anne Arundel County Network of Care. Another one is SAMHSA website. All of those are resources for you. If somebody is in immediate medical danger and needs to be seen immediately, an emergency room is the place to go. There are some hospitals in Maryland that do have specialized detoxification units. Those are Mercy Hospital, Bayview, Suburban Hospital, Montgomery General Hospital. One thing I want to caution you about, though, is if you call a provider, a treatment center, a therapist, an outpatient program, I want you to remember that you're interviewing them as much as they're interviewing you, because most of them will do some kind of an intake screening to make sure that they're the right facility, but you need to make sure that the loved one that you're sending there is the right facility. And as Catherine was saying, many of our patients, probably 80% of our patients have co-occurring mental illness and a substance abuse problem. And if you're referring somebody there or trying to get somebody there for that kind of help, you need to make sure that the program can manage and treat both illnesses at the same time, because that is really integral to ongoing recovery.
Thank you, Helen. Chief Altamiri, what law enforcement practices are in place to apprehend and prosecute those who distribute these drugs?
Yes, sir. If I might, before I launch into answering the county executive's question, I'd like to take a minute too, and I think it's doubly important for me to say this out loud to Russell tonight. I'm proud of you. I'm proud of you. And cops, we're having to evolve to effectively deal with this crisis, and I think it's hard to hold a mirror up to yourself as a profession and say we've got to get better at helping people. But We have to do that. And that leads me into the county executive's point here. I want to draw kind of a different stance, if I may, between how the police department is willing to deal with folks who need that helping hand to fight this addiction that they're going through, and then folks who are selling and profiting from the sale of slow death in our community. And as it relates to those people who are profiting from this cancer on our society, we've got to go after it full bore, 100% at 100 miles an hour. And it has to be a multi-pronged approach. We kind of think of successful prosecution, successful catching of bad guys in this country as a pyramid. We have to have the pursuit of those bad guys, and we have to have a successful apprehension of those bad guys, and then we have to have across the bottom, shoring the whole thing up, a successful prosecution. And all three of those phases of the fight against drug dealers are important. So to talk about what the police department's doing, first and foremost, the good news on this front is for the first time in 20 years, last year, the police department started growing. And I can tell you that at the low point of our attrition in the past 12 years, Anne Arundel County had 4 covert narcotics detectives. That is probably 80% less, at a minimum 80% less than every major county around us. It was a recipe for disaster, and it really put us behind the 8 ball in both the pursuit of drug dealers and the pursuit of intelligence that helps us catch those drug dealers. So the good news is we've quadrupled the amount of folks out there doing traditional narcotics work in the community. They are the guys who are out there with scraggly beards and would scare you to death if you ran across them in a dark alley, but they're doing great work. As a part of that effort, we've put together the first ever intra-county heroin investigative task force in the county. The chief of Annapolis City, Mike Christou, is in the back. It took all of 30 seconds when I asked him for help to commit to giving me a detective. The sheriff's office, for the first time in history, gave me a detective and gave me a drug dog, which night after night, as they're out there going after the folks selling this stuff in the community, is hugely beneficial because it lets them do things right on the spot based upon the probable cause that the dog gives them. We also put 2 county detectives in this task force, and I don't want to say his name out loud, but arguably the best narcotics sergeant in Anne Arundel County in the task force. They have gone to work with a vengeance. They are pursuing drug dealers from Brooklyn Park at the Baltimore City line down into Friendship, Deal, Shadyside, and the Calvert County line. I can tell you that they've put together several great cases. I don't want to talk about details with that, but I can tell you they're working their way up to get the bigger dealers. And I can tell you also candidly, without going into a whole bunch of detail, we're working very hard with our federal partners, all those alphabet agencies that you've all heard of. I had a great meeting with some folks this week who put together some spider webs for me that are going to cause some hate and discontent in some folks in the community, selling death, and that's a good thing. The second thing as far as cops go is I've really tried to incentivize heroin work for our patrol guys and gals. And I can tell you for years, the message, I waited for years to hear a boss say, go get it. And my cops are absolutely 100% on board with going out and helping the community and trying to take these folks off our streets because they know that they're systematically dismantling everything we hold dear in this county, in this country. So we're doing some good work with that. We've got more cops doing it. We've tried to increase communication between those cops out answering 911 calls at night, the guys who find the puzzle piece at 1 a.m. that helps lead us to the big fish for the narcotics detectives. We're doing that, and we're doing it fairly well. We've increased our efforts at intelligence gathering through overdoses and the arrest of addicts. Every addict knows 3 or 4 dealers. They probably have a favorite, but 3 or 4 dealers is a low ball number, folks. So every addict we talk to, we try to get them to talk to us. We try to get them to talk to our in-house clinicians. We got options for help for you, but we need to know who's selling the death in the community. And you're helping your cousin, your little sister, your best friend. You're helping them not get hooked on this thing that's caused you so much misery in your life. So we're really putting a lot of efforts into that. And I have to be honest with you, we hit a couple hurdles about October time of last year with a Supreme Court decision that really impacted our ability to get into people's cell phones post-arrest. And we also had some legislation that really made it harder for us to use charging as a leverage to get to treatment for the folks who were suffering from addiction last year. But we're trying to put our efforts back together. We're trying to work through some expedited paperwork to be able to get search warrants on phones when we come across them, to put that spider web together so I can give them to my federal partners who have that huge supercomputer and the budget to do the analysis that tells me who these folks are. And I'll say this again. 10 people this week were brought to my attention. I knew some of them already, but I didn't know how deep it went, and we're going to negatively impact their lives in the near future. So it's a good thing. And then if I could say one more thing, because I know I talk too much. None of this matters without good prosecutors, and I'm telling you folks, I am so grateful and hopeful. Did Wes walk in yet? Yeah. Are you here? We have a dedicated heroin prosecutor for the first time that I know of in our history. And I've got a state's attorney that I talk to 4 times a week, and we plot and plan, just like the bad guys do, how to best do our job. So it's great.
Underscore something the chief just pointed out to you. The police department's approach to users of these drugs is very different from its approach to those who distribute. If you are a user, the police are your friend. They will help you. They will help your family. They will help you get into treatment. Work with them. Do not be afraid of them. If you are a dealer, be very afraid of them. They're going to put you in jail. In fact, I'd like to ask Terry Kokolas to please stand. Terry Kokolas is the superintendent of our Department of Corrections. He is effectively the warden of the Anne Arundel County jails. If you're a dealer, plan on meeting him personally very soon. I'd like to ask Russell one more question, and then we're going to go to the audience. Russell, how are middle school and high school kids getting these drugs?
Unfortunately, from my experience, they're very prevalent. You'll have kids in middle school that are mainly dealing weed, but they buy their weed from people that are older that are selling the rest of the drugs. And it's unfortunately supply and demand. Whatever they're being asked for is what they're going to buy to sell because they want to make money. Pasadena, Glen, Brooklyn, surrounding areas, I mean, it's a sad thing to say, but you don't have to go but a few miles and you can find someone dealing heroin. And if you're a drug addict or a drug user, you know what to look for. You know the signs and just how someone carries herself. You can pick them out and find drugs pretty much no matter where you go. And it's unfortunate, but everybody hangs out with a friend that has an older brother that smokes weed, and the older brother than that is drinking and doing pills or heroin. And it's just, it's everywhere. It really is. It's not a good thing to say. It's just very prevalent. All over Pasadena and Anne Arundel counties, the surrounding counties, up and down the East Coast. It's not hard. You can get it no matter where you are. So.
Thank you. That's the challenge before us, isn't it? At this point, we want to open it up to questions from the audience and from those at home who have Twitter in some questions to us. If you have a question, there are 2 microphones down here at the very front of the aisles, and feel free to come down, get in line, and we're gonna go for about 40 minutes. So, yes, ma'am.
Hi, how are you?
Yes, sir.
My name is Babette Sibley. I'm a registered nurse. I've been a nurse for about 27 years. Most of that time I spent in ER trauma nursing. And in the course of that time, I've watched the way that we as healthcare providers deal with pain management. In 2001, the Joint Commission on Accreditation of Hospitals, which is the organization responsible for monitoring the safety and quality of our nation's hospitals, went on a national campaign and made pain the 5th vital sign. So that was just over a decade ago or so. All the other vital signs can be measured objectively. However, pain is a subjective sign. So pain at this point is whatever you say it is. So to tag off of you, most patients can't make the distinction between emotional pain and physical pain. So when they come to me as a healthcare provider, they may be experiencing emotional pain that I'm medicating as physical. Because that patient's telling me it's 10. The sad thing about that is healthcare providers, we're in the middle. We are caught in the middle. Because the Centers for Medicare and Medicaid Services, otherwise known as CMS, maintains hospital quality initiatives. And under the subtitle of Hospital Consumer Assessment of Healthcare Providers and Systems, which is everybody in this room has the ability to rate your hospital, rate the care you receive, and under that, there's a subtitle called pain management. As a healthcare provider, if you tell me your pain is 10, and I don't give you Dilaudid, a very highly addictive, highly effective opiate, for your head now, I am reported. I did not give quality care. As a healthcare professional, I am an underpaid drug dealer. In the last decade, the amount of pharmaceutical prescriptions for opiates has more than doubled, even though the numbers hitting the healthcare system has not. So our children have access to prescriptions because the adults are getting the prescriptions. How did your son have a bag of pills? Because the doctors and the nurses are being mandated by the federal government to give it. We're caught in the middle. We've got a crisis. And I think that because the state of Maryland and Anne Arundel County are leading in reform, this is all about reform of pain management and how we're dealing with pharmaceuticals. I think Maryland can lead the way, but it's got to go to the federal level.
Well,
because right now the CMS is telling us we get Medicare and we get Medicaid funding. The hospitals get it based on those surveys. So if I'm not surveyed well as the bedside nurse, the hospital gets dinged and we're not getting paid.
And we're trying to work. I think everybody on this panel is really excited about the new administration, especially Mr. Hsu and Governor Hogan, because we are all ready to take this to a legal level for the very reason that you're saying. And I work part of the Fed Up Coalition, which is doing the same thing on a federal level. We did manage to get Vicodin pushed up a notch into the other, the type 2, the level 2 drugs instead of down with the marijuana. Vicodin was the same risk category as marijuana until last year. And I want to tell you something else. Thank you for coming here as a healthcare practitioner, because I too worked in an ER for 13 years. And it is disgusting. It's like a Pez dispenser. And until we start to fight big pharma on a professional level, checkbook, I can't write the big check to the lobbying people in DC, but all of us together,
We can.
our voices have got to be heard. Our voices have got to be heard. So thank you for caring enough to be here. Thank all of you for caring enough to be here, because let me tell you, 5 years ago, the H word, you couldn't say heroin. You couldn't say addict. Nobody talked about their alcoholic grandfather. We brushed that. It was the family secret. Pain has never killed anybody.
No.
Overdose kills.
Well, there's a running joke now that RN stands for refreshments and narcotics.
It's so true that these addictions so often start harmlessly with prescription drugs. Sometimes it's overprescribing by the medical community, but sometimes it's just a leftover bottle still in the medicine chest. It's a prescription that got out of hand. You know, when the doses are complete, throw it away. Don't leave it lying around where anybody can get it. Gentlemen here on the left.
In the county, do we have a drug box?
All 4 police districts have a drug box, folks. We talked a little bit yesterday about people being intimidated to come to the police station with the drugs. Nobody's going to ask you anything if you're bringing pills to throw into that drug box. We are trying to foster a relationship based upon trust and respect so people feel comfortable bringing them. I give you my word today, nobody's going to stop you pulling into the police station and try to get the drugs out of your car and put handcuffs on.
I just want to add, though, that most states, including Maryland, have, if people have heard of, we have a prescription drug monitoring program that's been done for about 1.5 years. So any physician, when they're seeing someone in their office, in the ER, can go into this and see if that person's been prescribed other controlled substances. And that has made a big change in the prescribing, and the state can actually now monitor physicians, and they've gone after and shut down some physicians who were way over prescribing. All of that sounds great. The part of the problem with that, though, is that it has made prescription drugs harder to get, and that's leading to an increase in heroin. So, not to say that all of the things that you just talked about aren't important, and again, that pain in the fifth vital sign, people are now saying, we really overcalled that 15 years ago, and so doctors are being trained in how to use opiates and to not use them that way, but now it's it was already out there, and so a lot of the people that are already using are turning heroin, as you've heard about, because one, the price, and two, it's just much harder to find the prescription opiates now, partly because of the things we've tried to do to help the problem.
I'd also like to comment, not just physicians can see that, but electronic medical record, registered nurses can also take a look at that when they're treating their patients and see where they've previously been prescribed opiate medications.
Okay, thank you. Gentlemen here on the left.
Thank you, sir. First of all, my name is Tim Murnane. I've been around here practicing law for 36 years, a decade as a public defender, and the rest of my career pretty much in criminal law. I want to thank County Executive Shue, all the members of the panel, Chief Mike Priesthu, Wes Adams. It's wonderful to have such a coalition of leaders get together. And of course, everybody in the audience who has a concern about this topic. Let me share with you, as a grizzled veteran of the criminal courts here, that in 1988, Governor Schaefer created a drug czar, and that drug czar was a relative of mine. They went throughout the state doing exactly this, and in 1988, I stood right here, and I posed a question, and I pose that same question today. And that question is, why can't we keep it simple? Now, County Executive Shue asked an entirely appropriate question of Andrew. How do we get help? And she gave an entirely appropriate answer. Well, we call the health department, we phone number that I can call?
Yes.
One phone number. That's what I want. So right now, having listened to the presentations, you know, I would call Russell, or I would call Andrea and say, hey, this is my situation, what did you do?
Can I?
Oh, please, please.
Yes.
In 1988, I never got that answer. If you can give it to me today, God bless
I've
you.
been waiting for this. So it was my privilege to be the director for Anne Arundel County's crisis response system for 7.5 years. And when I stepped out of that role, I am now doing something even more aligned with what I want to do every day, all day, and I'll explain that in a second. But the long and short of it is that unbeknownst to many people, for reasons that still aren't clear to me to this day, the Anne Arundel County has a crisis response system. The phone number is 410-768-5522. It is a 24/7 system. When your loved one is in the house and exhibiting symptoms that are out of control and you are not sure what to do next, you're wondering if they need substance abuse treatment, if they need a mental health urgent appointment, if you're not sure what it is that they need, and you are overwhelmed or they are overwhelmed, that is the phone number to call. And I am not exaggerating when I say that the system has actually grown since I left it, and they have this wonderful relationship with our new chief, who actually is able to dispatch something called a mobile crisis team. And there's, if you haven't heard about it, a clinician, and in some cases with CIT, which is a similar idea, along with a police officer, 2 human beings that are able to come wherever you are and assist you with a mental health crisis on the spot. They run hundreds of calls every month. They run thousands of calls a year. That number leads to all of that. So if you have someone in crisis and you don't know what to do, call the number. There is someone on the other end of that phone who cares, I promise you.
I have to say, I have used that program many, many times. But is that on billboards?
We have
Is
no
that on
building.
police cars?
Perhaps
Is
we
that on
need to think about
signs?
some marketing.
That's the point.
Yes.
Well, there's the challenge and there's the opportunity.
And I can answer a little bit further out even than just that. I am blessed to work with some of the finest human beings on this panel and out in the audience that I know very well, who have brought together some of us that really do care about this problem and want to do something real about it. And they are looking at even greater roads of collaboration that simply are starting to exist because of the administration's actual interest in taking care of this, and those of us who have wanted this for a very long time. So there is a lot that is about to come to fruition because the energy and the interest and those that can actually do something about it are actually coming together, and collaboration is the key here. When we're talking to each other for the same need, for the same person, we can do a lot.
Mr. Renee?
Yes, sir.
We are actually putting across the disciplines our marketing folks together.
We're working.
So, Miss Nancy, when did we, I know we scheduled it, I just can't remember when it is. So, we're getting ready for that push in the school, whatever media that the guys who are good at, and gals who are good at this come up with, but I think you're going to start seeing more of that in the near future.
Wonderful, sir. Thank you so much.
Thank you.
I'd like to make
I'd like to ask everybody to keep their questions very brief and our answers very brief. We have a lot of people who would like to answer questions. We've only made it through 2 so far. So at this pace, we won't get to everybody, and I really want to. I'm going to take a few more from this side. I know you're next to the mic on the right, but these folks have been waiting actually longer. I've been kind of watching. And so let's try to keep the questions and answers to a minute or so. Gentleman here on the right, on the left.
Thank you. My name is Ron Grilson. I'm also a treatment provider here. I've had an opportunity to talk to a lot of other treatment providers here, and the vast majority of them seem to agree that what we're doing now is really a Band-Aid effect. We're addressing the consequences of what the real root cause is. And the root cause, according to my colleagues and me and my patients, my clients, are basically what the first young lady had to say. It concerns me greatly that she would admit here to all of you that her doctors are writing prescriptions based upon what a client tells them they want, just so that they can get paid by the federal government. My question to you, doctor, is that until you put a stop to doctors writing prescriptions that they then cut people off on, forcing them to go to the streets and buy heroin cheaper than those prescriptions, we're wasting our time here. What are you doing to get a handle on the doctors that are over-prescribing medications that aren't needed just because somebody says my finger hurts and I have a 10? What are you doing to police your own people, and what are you doing to put doctors in jail where they belong?
So the prescription drug monitoring program I mentioned, the state has already used that and has gone after doctors. The nurse talking about being an ER nurse, the Maryland Emergency Medicine Agency, they have come up with guidelines for all emergency rooms to use to only prescribe minimal amounts, so you can't, there's no way to stop it, but they're being highly encouraged to only give a day or two's worth, and then you have to go see your doctor. The hope is you don't go into an ER anymore and leave with a month's worth of something. There are now, when every other year we have to renew our license, this is the first time that Maryland has ever done this. We have to take, so many continuing courses or whatever. They've never said you have to take a certain topic. Right now, the state is now mandating that physicians take something and prescribing control substances and pain management. It's the first time they've ever actually said this is a thing which you have to take. So there are a lot of things that are being done. You're right, it's a huge problem, but it's something that Maryland is specifically addressing, and there's some other federal issues as well.
Thank you. Thank you. On the left. Yes.
My name is Joanne Melton, and anyway, I'd like to say that the only reason that I've come tonight is because I actually wanted to meet you. I have, it's true, it's true.
There's easier ways.
I read your bio, I'm very impressed. You don't need this job. I'm assuming that you've taken this job because you believe that you can bring about improvement in the areas needed. My son died of a heroin overdose on October 18, 2014.
Sorry.
I've learned a lot about a drug that I didn't know much about before that. He wasn't an addict of heroin. It's a long story. Not necessarily a typical heroin death, but I've learned a lot since then. If you lose your kid, suddenly you just can't read enough about it. I have some additional insights that I've gotten through other parents in bereavement groups, online, people in other states, most of them in other states, a few also here in Maryland. There are two different forms of law enforcement, and basically Maryland is not on board with where we should be. Neither is Ohio, neither is Massachusetts, neither is New York. These are all, coincidentally, states that have among the higher death rates. Maryland is now averaging approximately 10 per week, and that's if the rate remains steady. 520 for the year 2015 if the rate does not increase, but it has been increasing each year. It will not surprise me if we hit 700 young people dead in Maryland this year. Just for contrast, that is actually a higher rate of death than the Vietnam War ever took from Maryland. Okay? This is truly out of control. We have two forms of law enforcement, and most of Maryland is not on board with where we need to be. Sadly, Anne Arundel County is not. State's Attorney McCarthy in Montgomery County brought this county on board 3 months ago. With each heroin death, there is a full, basically what they call homicide investigation, which means the death is actually investigated. They attempt to find the dealer, they attempt to find other people who may or may not have shot up this person, try to find the source of the drugs, whatever they can find. Carroll County is doing the same thing. State's Attorney there, Mr. D'Alessandro, is very proactive in his approach. He's actually come to Annapolis to testify in support of the bill, which has unfortunately already died. But he wants to see a state approach to the Len bias law, which permits prosecutions of drug dealers who provide heroin to people who later die. It can provide beyond dealing, it would hold them responsible for homicide. This bill has died for this year. It'll be back next year. Mr. D'Alessandro came out in support. Mr. McCarthy also came out in support. Law enforcement from those two counties came out in support in the House about a month and a half ago. The testimony from law support was that from law enforcement was that approximately 60% of the time they can trace the source of the heroin. 60% of the time. Unfortunately, in Anne Arundel County, we don't make that effort. In most counties in Maryland, we do not make this effort. This is going on in Carroll County, this is going on in Montgomery County, and Calvert County, and possibly St. Mary's County. There may be one or two others that I'm not aware of, but it's certainly not going on here. And absolutely not in Annapolis, the mecca of heroin for Anne Arundel County. They are doing nothing. They're doing nothing. No investigation, no accountability for the deaths. They're picking up the bodies, and believe me, I would not lie to you, and it was a shock to me to discover how it's really done. They call the coroner's office. The coroner's office comes and picks up the body, takes it to Baltimore. The autopsy is done. The toxicology comes back 12 days later. It's a drug overdose. Case closed. Case closed. Done. Absolutely done. We can't fit any more bodies under the rug, okay? The old method of doing this is not working, okay? There's zero accountability, and everybody knows it. Everybody knows this, okay? This happened to me, and I have conveyed this to several hundred people already, okay? The word is out. There is no consequence, okay? Anne Arundel County needs to wake up and start doing things the way they're done in Carroll County, the way they're done in Montgomery County. And I might point out that because of the efforts of Calvert County law enforcement, they actually leaned on Annapolis hard enough to cause an investigation, which resulted in like 18 drug dealers being arrested last spring. Thank you, Calvert County, for calling Annapolis and waking them up. I appreciate that. We need Calvert County to call Annapolis and wake them up again. I realized there was just a nice little drug bust a few days ago in the Harbor Center. I saw it, okay? There was an alert policeman that was called to a citizen complaint. There was another arrest in the mall, one or two people about a month ago. Yes, I know, okay? These were not undercover sting operations. Annapolis Police has cleaned up its heroin problem with those 18 arrests that happened last spring. They're still patting themselves on the back for that. They think it's done.
We need to
Do you
go to the
think,
next question.
Mr. Shue, would you please call either Mr. McCarthy in Montgomery County or call Mr. D'Alessandro in Carroll County for their insights on why they've changed their law enforcement and investigative divisions, because we need some change here.
We will reach
The
out.
old methods are not working.
We will reach out. Thank you very much. Let me take the young lady in red here on the left side, and I'm going to go to this very patient young lady. They were in line, believe it or not, a lot longer than you were. I'm not kidding. I was watching.
Thank you.
Jordan.
That is true. My first question this gentleman brought up. I'm here because I lost my brother 8 years ago this May, and unfortunately my parents were not able to provide him, coverage on their insurance. So as a sibling, who, I had my own insurance, but it doesn't cover siblings. I wasn't able to find the help that I needed for him in time, and we didn't lose him. So again, thanks for saying that number and hopefully getting it out there to the public, because I had no idea where to go. And I worked in a state government job, and I still could not find the help that I needed in the governor's front office. To that end, I wanted to just make a comment to the detective. I appreciate the fact that you made a point about the difference between users and sellers and helping them. However, I wonder if a user doesn't want to tell who the seller is. I mean, is it true that you're not going to help them? Because that is the case with my brother. He would not give up who sold to him. And I believe that pushed him over the edge. It was a lot of pressure. And he ended up spending his last 2 years of his life in jail. So I just wanted to bring that up. I appreciate you needing that information, but an addict who needs help may not need that added pressure.
So let me assure you, ma'am, the efforts that we're going through, and law enforcement has had to and will continue to get better at extending a helping hand. There's no correlation between whether they tell us criminal intelligence and whether they're trying to get help. In fact, every person who gets arrested or overdoses for an opiate or heroin in Anne Arundel County gets a call from mobile crisis management. Clinicians, like Catherine, within, depending on what day of the week it is, within 24 to 72 hours, separate from police involvement. So they kind of fall under my umbrella, but they're there solely to help. If that makes sense, if I answer your question.
So you're saying a doctor is in touch with them, or?
No, ma'am, a clinician. So it's, Catherine, can you explain better?
I'm a mental health clinician, someone with a mental health licensure that can either do something on the spot or give a referral. Urgent care appointments are usually what's needed in that case, and actually our county is currently working on looking at expanded opportunities for us to be able to provide even better care than we currently do, and that's in the works, and there's a lot of people working very hard at making something that will really make a big impact in our county happening hopefully in our very near future.
Okay, thank you. So, and I would really appreciate it if we could look into, family support systems and siblings helping, not just parents who are covered by their, parents' insurance. People who don't have insurance really need help. Thank you.
Catherine gave you a crisis response number, but if you don't remember it or lose it, you can always just call the general county phone number. Just call the county. Our operators will know how to direct you, given what you described to them. Let's go to the very patient folks on the right side. Yes.
My name is Jennifer, and my son didn't here because I am a Powell County resident. My son died of heroin overdose not quite 2 years ago. And he was started with prescription drugs after an injury. He was clean for a couple of years. He re-injured himself. We went to the doctor here in Annapolis. The doctor, an orthopedic surgeon, he said, for a little bit of time you're going to be on this medicine, you'll be fine. I was standing right there. My son said, I'm in recovery. He said, you'll be fine. Gave my son a prescription. We left. He filled it. He seemed to be doing fine. Surgery was successful. After work, seemed fine. Everything seemed fine. Happy, ex-girlfriend, everything. And all of a sudden, we started noticing the changes, right? Because we've already been down that road. We've already been down rehab. I didn't know what heroin was. I didn't know that heroin was the devil. So when I questioned my son about what you're doing, when I heard that he was shooting dope, he said, as an addict, because when an addict's line, they open their mouth. Pretty mama, I'm not shooting dope. And so I said, okay, but if you are, let me help you. A couple of days went by, I saw him again. I said, I know you're shooting dope. Let me help you. He assured me it was no big deal. I got this. So I thought with the pills, because I was naive, okay, he's got this, right? We got it with the pills. Maybe this isn't a huge deal. 3 days later, his younger brother finds him dead alone in the bathroom. And our lives have been changed, and I will say ruined forever. I've been really involved since my son Jake's death in getting the Good Samaritan bill passed to law, effective this October. I now train parents, because I believe parents are first responders, in how to use naloxone. I've been training here in the state of Maryland. And we need have to understand and work together. And I'm very proud of you down there. Very proud.
The lady said something that's very important as we leave here tonight, folks. If you're here because you're concerned about a loved one, the lady said a word that means nothing unless you know what you're listening to. She said the word dope. If you hear the word dope out of your kid's mouth, he ain't talking about weed, marijuana. He's not talking about anything from Baltimore to D.C. to Coward County but heroin. If you hear that word, if you hear conversations about it, we're talking about your loved one being involved in some way, shape, or form with heroin. It's a very important distinction, because I can't tell you how many parents I've heard have heard that word and thought their kids were talking about marijuana, and I heard it already tonight. It ain't good, but it ain't that bad. Dope is heroin. There's 100 other clues, and we need to start educating people better about that. But I couldn't let you leave tonight without getting that one out to you.
The nice lady on the left.
Hi. So, I have two older twin brothers. They're both heroin addicts. They're going to turn 30 in April. My one brother died of heroin overdose 7 weeks ago. The other one is in recovery, and he swears he's never going to use again. You know, it's what my mom through with finding my brother. But the problem is that I have a question specifically for pathways. This has been a long road, a lot of years. We've gone through a lot of rehabs. My parents have put out a lot of money. You know, we've had insurances. After insurance to come out after 14 days because your insurance isn't going to cover it anymore. And I'm sorry, but I don't care how much money you make. You can only afford so many rehabs at $1,000 a week. It's expensive, and everybody knows that. So specifically, almost 8 weeks ago, on the 28th of January, my brother was struggling really, really bad. He walked upstairs to his twin brother and said, "Hey, can I borrow Suboxone?" Sure, why not? He took the Suboxone, which I'm sure not a lot of people really know the major side effects of Suboxone. If you use heroin the day after, you can actually have a heart attack. It can be very, very, very dangerous. You're not supposed to use it as a day just to get clean real quick to fix the way your body's feeling. You're actually supposed to, you know, stay on a regimen. So he went and, you know, got his Suboxone from his twin brother, came downstairs, used it the next day. His tax money came in, went and bought $100 worth of dope, and of course he didn't get high, he was still in Suboxone. He waited until that 24 hours kicked in, went and bought another $100 worth, put it in his arm, $200 worth, is still in his body, fell asleep instantly. However, you guys did a fantastic job with us that night, so I know that you guys frustrate a lot of people, no offense, and we're frustrated too, but you guys were very kind to us the night that my brother passed, and did wonders with us. But my question specifically is, if he needed help that day and his insurance wasn't supposed to kick in until February,
It was Tuesday, the following week, he would go in.
to rehab, because the insurance was supposed to officially kick in.
No one would take him to that little lab.
And he didn't want to go to the hospital for an emergency because he says, "I'm not suicidal, I don't want to die." But what is that in-between time when you can't get into a rehab, you're waiting for your insurance to kick in? A lot of problems with rehab is insurance. And I walked downstairs specifically earlier to say he left behind a 7-year-old little boy who I have now custody of. And he left him behind, and I'm like, is there any kind of grief counseling I can get? I swear, 4 different people said, "What's his insurance? Insurance, insurance, insurance." What else can we do? It's not all, it can't always be about insurance, right?
It is.
I'm very sorry. So let me try to help you with this question. And I'm very sorry for your brother and your son and the family. I can only speak for Pathways, but most of the substance abuse inpatient and outpatient treatment centers are nonprofit. Most of us are on either a break even or at a loss. Pathways runs at a loss. We are supported by Anne Arundel County. So, of course, in order to continue to give treatment, we have to be fiscally responsible. We do have 2 charity beds and pathways that are available. That is an option. I wish the story was different, but it is not. The state has been very generous this year in giving us extra funding to help with through medical assistance. There has been a lot of work in the county, in the treatment centers, through the hospital, in getting people covered through medical assistance so that they will have the coverage that they need when they ask for help. It is still not 100% perfect, you're right. And our struggle is when we have to say we can't take you. That's the worst thing we can say to somebody. But there is a limit to the charity care that any facility can give. And so I again would direct you back either to crisis response, or I would direct you to the health department, the county health department that you live in. It's not easy as an executive director too to make these choices. When you get a phone call and somebody's looking for help, and you know you have a responsibility as an organization to the community, to the people that you're helping. But unfortunately, treatment does cost money.
I understand.
And so it is a difficulty for all of us, and I truly understand it. And so I can give you the resources that I did. It's not perfect, but we are working towards making it better every day.
And I'm happy to read her number. But unfortunately, it didn't work for us numerous times. But I'm sure it works for other people, so I'm not knocking it. But
I would like to make another recommendation to it. Captain, what you said is absolutely 100%. But we receive about 50 to 75 phone calls every single day for people looking for help. Not everybody's in a crisis. There are some people that just need an outpatient level of care, somebody that has a DUI report has said you need help, etc. So I would also recommend that if you're having trouble getting through to any, you can always call us, because even if we're not the right place, we have all adopted the mantra that there really is no wrong door. So if you come knocking on our door, we will try our best to find the right place as soon as possible for whoever calls
I
us.
think it's also important that anyone who hasn't read in the paper or is unaware that the county, because of all of this effort and in part just some very good timing on the part of an agency named Gaudenzia, that we are about to have a lot more opportunities for treatment in our county because we don't have enough currently for the need. We have had to use treatment facilities all over the state of Maryland, and in truth, all over the country. It got to the place where we were sending our county citizens outside of our own state into far-flung places as far as California and Florida. And there are many, many families that we've talked to, and actually crisis response has helped place that in recent times so that they can get the help that they need more immediately. But there is a treatment facility that is going to open as soon as possible, as soon as potentially this summer. And it's going to increase, hopefully, the bed capacity or the treatment capacity greatly in our county. I'm working with them, trying to put something for this gap that you're describing into place so that the gap in our county is much less than it is right now.
We're also working on that gap because we have had waiting lists for our beds, and so we are working on it by offering other services. And one of them is going to start in April, which will be a outpatient detox with an intensive outpatient and a Suboxone maintenance program, so that we can respond quicker.
We need more, you're right.
Man, when they say we're talking, if a knucklehead like me is noticing the talks as we all get together, they're talking, honestly. That bridge that you just talked about, that gap, has been a huge conversation for us, and what can you do about it? I give you my word.
Thank you very much. Why don't we go to the other lady? Go ahead.
Speaking, I understand that everybody takes a very clinical approach to the question. Speaking from an addict that has been through the physical addiction and had to wait 2 weeks to get into rehab and been in recovery and wanted to use and don't want to call and talk to the phone, look into the rooms of Narcotics Anonymous, Alcoholics Anonymous, and just go there and sit him in the room next to you, and you start talking for him. Another addict come up and speak to you, and him seeing them reach out to him can saved his life. It stopped me from getting high many times. It's helped me many times. And it doesn't cost a penny.
Ma'am, don't leave tonight without you and I talking, and we'll talk about that 7-year-old too, okay?
My name is Laura. I'm a recovering heroin addict. How I've managed to stay clean this time around is by working all aspects of it. I've been getting treated for my mental health problems. As far as spiritual, I've been in many meetings, but there's also the physical side that I feel that needs to be treated. And I am in a methadone program, and something that Russell spoke about earlier about how people look down on it, and it's understandable. A lot of people give it a bad name. Some programs, will let people get as high as 200 milligrams. I've heard some people will mix, Xanax and other pills with it. So a lot of people look down on it and think that it's just another way to get high, or some people say, oh, it's a crutch. And that may be true, but some of us need a crutch. The physical part is a lot of reasons for relapse for a lot of people, and not being able to deal with the withdrawal stuff. I guess, and I don't know if this was true, I heard that there was supposed to be a methadone program in Pasadena, but the people had a riot or something against it. Pretty much my question is it's helped me a lot, and it has helped a lot of people if it's used the right way. How can, because the programs be regulated and there are rules set in about how high of a dose we can go to, or not letting patients take these pills while on the program, just so that people will be more open to it, and that we can have more access to these programs, because I do believe that just going to get a dose every day is not going to help, that you have to work all aspects of it, but I do believe that the physical withdrawal for a lot of people trying to get clean is a big aspect. So just, I guess, how can we raise awareness to people who are against it, and how can we, clean up these programs?
So one thing, I prescribe Suboxone. I work in a methadone clinic, and so I'm glad you had the courage to get up here. I think it's just important to hear from both of these guys that the vast majority of people in methadone and Suboxone are doing well, not misusing it, and it's the people you see and assume that they are misusing it that is something to think about. The state is actually trying to really work with programs to get them to kind of be more careful. And that prescription drug monitoring program I was talking about, they're trying to make all methadone clinics check that to see if somebody's getting prescribed Xanax or whatever it is. So yeah, the state is trying to do something about that. But again, I think it's important for everyone to not think that people who are using the medications necessarily aren't in recovery, aren't using a crutch, like you were saying, that it does help a lot of people.
How old are you?
23.
You're beautiful. And you are part of how we're going to fix it. Break the stigma. Stand up and say, I'm a heroin addict in recovery, and yes, I use methadone, or yes, I use Suboxone. Break the stigma, girl. Be proud. Be proud of yourself.
Thank you. This is a really important conversation we're having tonight, and we obviously have a lot more people with questions, and I want to get to all the questions. Now, the program is supposed to end at 8:30. So here's what we're going to do, if the panel is willing. We'll officially end the program at 8:30, but we're going to stay. And those that would like to stay, you can stay. We'll try to get to all your questions as best we can. If you need to go, you're welcome to go in just a minute. If you have not already visited the providers downstairs, please do. Out the door to the left, down the stairs, there is a whole group of providers of services who are there to help you in any way that you may need. And they're there now, and they're waiting to speak with you. So, and for the moment, I'd like to ask the state's attorney to join me here at the, oh, there you are, I thought it was that gentleman door. It's not clear in my house. So, we'll let the state's attorney say a couple of remarks, then we'll do the official close of the program, but then we're going to just keep the mics open and keep going. Are you guys good to go? Thank you. I appreciate it. This is our newly elected state's attorney, Wes Adams.
First of all, I want to say that it's actually really humbling to stand in a room awash with so much pain, and it's really encouraging to stand in a room that is enlightened by so much hope. Russell, I'm going to echo Chief and tell you that I'm proud of you because, you know, look, I'm the Chief Law Enforcement Officer here. Chief and I, we work together to battle this addiction all the time. I grew up in an addicted household. About 12 weeks ago, I got a phone call into my house about one of my immediate family members, and he announced he was a heroin addict. He started prescription pain meds. 7 years. No idea. It's what I do every day, and I had no idea. So I battled it, same battle with many of the families here tonight. I approach this in 3 different ways, folks. The first part is our kids. Prevention is really the way to go. Respectfully, Doc, we teach our kids that it's okay to solve things with a Strattera or a Ritalin or another ADHD medicine. We're learning about, I learned yesterday that there's a drug market for ADHD meds. Okay? We teach our kids at 8 that the way to stay calm is to take a pill. And when they hit 13, which most of us in law enforcement know where our addicts are growing up, that's when their hormonal changes start and they're having trouble in school and their friends are going. And that then it's okay to medicate and self-medicate. Russell tells you, he knows, you can find it anywhere. So we are raising a generation of children who look to a narcotic to solve a problem. That's our biggest challenge. By the time they get to me and Chief, we're in trouble. Our best drug courts, and folks, I'm 100% behind our drug courts. They do great work. But we can save 11 people in 18 months. We just graduated 11 people. It took us 18 months to get there. How many folks can we lose a day? You know, I heard one lady speak about 10 a day, or 10 a week. 10 per week in the state. We saved 11 in a jurisdiction in a year and a half. That's a losing battle for us. We fight because we know that addicts, we can help. As also Chief said, I echo his sentiment. We're going to go hard after the dealers. We'll make it a bad place to deal drugs here in Anne Arundel County. Is to interrupt the supply as best that we can. We have identified folks. We will go after them. It is a priority for me. We went out and sought some of the best prosecutors that I could find. Extensive experience, cross-border smuggling, importation, money laundering, supply chain. That's my commitment to the county here to keep us safe in this battle against drugs. 3 pieces: education, rehabilitation, and enforcement on those, Chief, like you said, who are dealing with stuff. This is the only approach that we can take to this. I'll tell you, it is everywhere. Most of you folks may or may not know, I coach sports at a young level. I coach them so I can stay in touch with our kids, see what's happening with them. I have parents on my team, recovering addicts. We sat down over a dinner table talking about the problems that they face. In our meeting yesterday with the folks from the President's administration, the point that was most important to me, and Russell, I'm ecstatic that you're here, because I am an expert in drugs. I've been prosecuting crimes for my whole career. You're my expert. And Russell and the parents of one of my players that are here, and the folks that are really recovering, the young lady who stood up, that's who we need to hear from, because you're better than any bicycle cop that most of us have. You can spot it. That's what we need. We need to hear the voice from the folks that are actually going through it, because unless you've walked a mile in their shoes, you don't know what they've gone through. And it's very we fight with an approach that has never really gone through it. So I will keep attacking the dealers. I will make this county as safe as I can. The folks here at the table, Chief and I, our drug courts, will try to rehabilitate the addicts. Parents, not only, and I missed another spot, Doc, not only do we teach our kids it's okay to give a pill or to use a pill, but when I got hurt and came home from my back surgery, I got 60 Vicodin. I took 2. That means I got 48 extra, or 58 extra. I didn't need 58 in the first place. I don't know why we get, I can think in obvious terms. Money talks. If I prescribe 60, I get paid for 60. I don't need it. Folks, take advantage of the drug box. Not only did Chief say we have 4, but under our new DEA regulations, we have expanded people who can actually take back drugs. Find them, give them up. If you're not comfortable giving to the police, I think there are other treatment providers of the hospital, as long as they have sufficiently locked facilities, they can take them back. Get rid of your extra drugs. Think about the medications you're giving your kids. Advil's great. It works. The last thing I want to talk about is how we approach I think it was Mr. Murnane who talked about, or Mr. Grossman who talked about the Band-Aid and not really the root causes. When I get folks in drug court, they have modeled abusive behavior for years. And I want you to think about this. The first time I have an opportunity in a court, because our juvenile courts, they have treatment facilities, but it's not the same type of accountability, is at 18 years old. Also, you started using it at 12?
Marijuana, opiate.
Okay. So, figure from wake up into the real world, 8, 9, 10 years old as a young kid. So as a point when children are reaching maturity and can interact at a more mature level, you modeled behavior that involved abusing drugs more than you did, correct? So at 18, I have someone whose behavior is set. 12 weeks doesn't change that, nor does 26. Recovery is a long-term, everyday battle. And so we need to treat recovery as a lengthy battle and not just a quick fix. We need to start early, we need to stay vigilant, and we need to keep working. You have my commitment as the state's attorney to attack all 3 phases: education, rehabilitation, and the dealers. Like I said, I'm really humbled to stand before you tonight, and I appreciate everybody coming out and lending their voice to this. And to you folks at the table, thank you for your expertise. Really great.
Let me conclude the official part of the program by thanking our panel for sharing with us their expertise. I also want to thank the providers who are downstairs, the service providers again on the way out. Please go downstairs and introduce yourself to those folks. They'll be happy to help you in any way they can. And most of all, I want to thank all of you for being here. There's so much pain in this room. All of you, you're loved one, someone in your life, maybe you yourself, has been hurt by these drugs. And we're sorry. We're going to do everything we can to help here in county government and in state government. And the best thing I can offer to you is God's peace and drive safe.